Hey, welcome to our Wellness Wednesday Health Show. I'm your host, Dr. Kali Hewlett from the Back Pain and Sciatica Center of Texas, where we offer regenerative pain solutions. And the purpose of the show is to introduce you to different health and wellness businesses and providers in the area that can benefit you. I'm excited to be on location today at Preva Healthcare Group. I say healthcare group because they're doing so many different things. And with our guest Derek today. Derek, welcome to the show.
I appreciate it. Thank you for having me.
Now, on this side we got Preva Physicians. Let's start there. What is Preva Physicians?
So, Preva Physicians basically is it's a group of physicians that have joined our network. We own a surgery center, and they are partners here with the surgery center. We have a lot of different specialties, ranging from spine to pain to podiatry, urology. So basically, we've just grouped everybody into the one name.
Okay, very, very cool. You know, you mentioned surgical center. I think, did you guys start with the surgical center then expanded into this?
It's kind of both. Our idea was always to have partners, and basically it was, let's have a in-network facility that we could partner up with physicians and basically provide customers and patients with some excellent care and an excellent facility.
Very cool. Do a lot of your physicians communicate, work together, and find that they just enjoy referring back and forth to each other?
Absolutely. So we've built the big foundation is having your MSO physicians, where you've got your primary cares, your chiropractors, all these doctors that are looking to send their patients somewhere where they're going to get the greatest health care. And what we've done is we've partnered up with everybody where they'll refer the patient to our physicians, then our physicians are going to see them there, and if they need surgery, then they're going to bring them to our facility.
Okay, really cool. You know, we were talking earlier about Sadler, and some of the people watching this may remember Sadler. Sadler at one time was probably one of the largest, if not the largest, healthcare provider in Montgomery County, and then it fell many years ago. But from talking to patients, one of the things they loved about it was they could go to a Sadler facility and they could have a trusting network of, hey, if I need this type of health service, you can refer me here or here or here. And since the fall of Sadler, as I call it, that's been lacking in the area. So not necessarily you want to be like Sadler, but what's the concept?
I think there is a lot of similarities. They had a great concept. I think that what we want to do is something very similar. This is going to be a medical campus, is what we're going to call it, and we're going to have all our physicians right here, so that patients can come in here. They can see the doctor, they can go do imaging, they can have PT after surgery, they can go to have surgery here. So basically it's kind of a one-stop shop. They're not driving all over the country trying to do all these different things when they can stay right here and get everything done all in one place.
Gosh, as a father of 4 children, and between business I have, my wife, and other commitments, like, time is valuable, right? So to be able to come to one location, one campus, like you said, and say, all right, I can meet with this provider, I can do follow-ups with this provider. If needed, I can do rehab, right? If I do need some type of surgical intervention, all these things can be in the same location. Like, that's huge. Just the amount of time that's wasted. I say wasted because there's a lot of time that we spend on the road each day that
you just can't get back.
No.
No, absolutely. But I think when you have that, and then you add, putting the care back in healthcare, I think is a huge thing, and we're here for the patients. We want to provide them with the best customer service, with the best facilities, and we have just such an excellent staff to be able to provide that. We've always had such great ratings and comments back from all the different patients that have come through the system, and such a positive feedback from everybody. It's a great thing to have.
It's cool because we have a group like that. One thing over the years, that just being in private practice for so many years, you find a doc, you refer them out to, and ideally you're on the same page, but sometimes patients get conflicted information. You may refer them out to one other provider and they have a different perspective, and instead of calling back to our office, now the patient's confused because they're like, hey, I just saw 2 or 3 different specialists and I trust all you guys, but you tell me different things, I'm confused. So it sounds like the part of the concept of Preva is that, hey, on the back end they can collaborate, communicate, so the patient can have a team approach. Is that
It really is. I think that's an excellent point. I think that the fact that a team is probably the best way to put it. Everybody's working together on the same page, you know, within communication. I think that really helps the patient out. So if there is any kind of confusion, we can get that straightened out right away and have a better outcome and a better experience for them.
I like that? You know, we were talking earlier before we started on the camera about private surgical centers. And I'll tell you, it was just a few months back, my son, my 14-year-old son, he broke his radius and ulna, right? It was a pretty nasty break. He needed surgical intervention. And so it was nice to be able to go. We didn't want to go to a hospital. Right? It's like the hospitals at that point, the hospitals were flooded with everybody that thought they had coronavirus. They were going and getting tested, or they were seeking treatment. We were like, look, we don't want to be around that. We just want to get his arm fixed. And so we went to a private surgical center. We felt safe. It was in and out. It was great. And so kind of let's talk about that a little bit. The shift away from hospitals, because more people say like, I don't want to go to the hospital, but I do need surgical intervention.
Right.
Talk about that.
I think that the big thing is going to be, especially after this pandemic, you know, patients are more aware. They're doing the research. They're understanding that they don't have to go to the big hospitals. They don't have to be sitting in waiting rooms full of sick people. I think what they've realized is they can come to a smaller facility. It's cost-wise, it's just the same, if not better. I mean, I know we can do a lot of things cheaper than a hospital can, so we can save the patient money. We can provide them with excellent service. But I think, kind of like what you're saying, they can come in. There's only going to be a few people in the waiting room because it's a smaller atmosphere. Especially through the COVID pandemic, we've taken all the precautions to screen people and spacing and everything. So they're going to come in into a cleaner, safer environment, and I think just the fact that it's a smaller, more boutique feeling, I think that gives a patient a better feeling when they come in.
That's great. For years, I mean, we'd always joke with my colleagues. We'd be like, "Hey, if you got a health problem, if you're sick, the worst place to go is the hospital, because that's where other sick people are." So, but you hear about those people that go to the hospital with one thing, then they catch an infection. And even though hospitals are doing their best to keep things clean, it's just hard to contain it when you have hundreds of sick people with multiple viruses and bacteria and diseases, many that are contagious. It's just hard to contain that just due to the sheer volume of numbers.
Absolutely.
So when you can have a smaller reception area, smaller surgical facility, you can eliminate a lot of that risk.
Absolutely. I think just infection alone is such a safer environment coming to an ambulatory surgery center versus going to a big hospital.
You said something earlier too about being in network, and costs can be very similar, sometimes even less. I know that's been a myth from talking to some patients in the past. They think, well, if I go to one of these private surgical centers instead of the hospital, it's going to cost more.
Right. Now it's everybody's always had that fear when they hear that we're out of network, and they think they're going to get this big bill, and that's not the case. I mean, we're an in-network facility. We're taking all insurances. The cost savings to them, I think, is going to be huge. I know that just insurance alone saves so much more money having patients come to facilities like ours versus going to the hospital. You know, we don't charge the same thing that a hospital will, and you know, insurance loves the fact that we have an in-network for all these patients to be able to come here.
Okay, that's awesome. You know, we were also talking. We talked for probably 30 minutes before we started the camera roll, and I was like, we just got to start because there's so much good stuff we're covering. How in the past 6-7 months, right, it's October 2020 right now, there have been a significant decrease in primary care visits, people showing up for regular checkups, screenings, people that know they needed surgery but were putting it off because they were worried about COVID and possible infection. Like, I think there's going to be a ripple effect for years to come of people delaying healthcare services that are truly needed out of fear.
Absolutely. I think that just like you said, there's going to be such an increase. Patients there's a lot of people that aren't leaving their homes. They're not going for their regular checkups. They're sick. They don't want to go to see a doctor in fear of, am I going to catch COVID or am I going to catch something else? And I think in the future, you're going to see ambulatory surgery centers really exploding. Just the customer service they can provide to what a hospital can do, just the sheer numbers, it's a smaller boutique feeling, and the fact that they know that they can come into a safer environment, I think gives them something to relax about.
I like that term boutique. When my wife and I travel, she likes going to these boutique hotels.
Right.
The big chains are cool, but just it's a different experience when you go to a smaller facility, go to travel, go to a smaller hotel. They know her name's like, hey, Mr. and Mrs. Hewlett, and it's just totally different experience. It's personalized, it's customized. We actually prefer that instead of the big hotels. We prefer going to those smaller boutique ones for the experience. And now you're saying, hey, that's not just for travel and hotels, but you can have a similar experience
Right.
in a healthcare setting.
Absolutely. I think we've got such a great staff, and that's something that we take pride in. We want patients to feel great about their experience. We want them to not be scared thinking, surgery is a big negative thing, that they can come in, they can have surgery, they can recover and get healthy again. We want to provide the best care for them. And I think, just because of the numbers, we can do that kind of thing versus a hospital. It's they're bigger and have more moving parts where we can provide that one-on-one, special care.
And I like that. That's part of the healing process. I'll share it with our patients that, we call it the Triad of health, right? There's the physical component, there's the chemical/nutritional component, and there's the emotional component, right?
Absolutely.
And if someone's stressed or worried, it actually inhibits their ability to heal. That's why if you've ever heard the term like stress ulcer, someone can get so stressed that it actually eats a hole in their stomach. Well, someone can be so stressed, we call it the fight or flight mechanism.
Right.
You can't heal when you're in a state of stress, like you just can't.
Right.
But when you can be in an environment like this, after a surgical or some other treatment that's needed, you can create an environment where the patient can heal better just because there's less stress in a small boutique setting.
Yeah, I absolutely. I can't agree more with you that I think a patient comes in that when they see the facility, they come in, they're greeted with the staff, just the feeling, the cleanliness, the whole experience from start to finish. It brings that stress level down, and I think, like you said, it promotes healing versus enhancing it. So I think there's a big difference between the two.
I think it's really cool. Now, where are you guys located at for everybody that's watching today?
So we're right here, right off I-45 in the Woodlands. We're looking to build more facilities like this, and so we're going to have this campus, and basically we're going to expand around the whole greater Houston area. Our idea is to have 4 or 5 of these all centered around, and then eventually have a boutique hospital as well, located right in the center of Houston. So I think that's kind of the goal for Houston right now, and then expand outwards into the rest of the country.
Very cool, very easy. I like that you're on the east side of the freeway, so sometimes when you get over there, there's a little more traffic, but right off the feeder road here in the Woodlands, very easy to get to. And then website, if someone's watching this and saying, hey, I have a healthcare concern, I want to see if I can come here, or if there's a need.
Absolutely. So prevasurgicare.com, you can check us out on the website, and there's a lot of different things, information you can click on and find out about us, and there's definitely all our physician partners that are all on there as well, and we can connect with somebody good.
Okay, very cool. And we'll put a link, for those of you watching this, we'll put a link below so you just click and follow it. Derek, thanks for the time today. Any final words of wisdom to our audience today?
No, I think that healthcare is changing. It's not, for the longest time, I think literally the word care has kind of disappeared in it. It's turned into a money machine that obviously money makes the world go round, but we're trying to go back to the old ways where people really do care and want to look after people and get them better. And I think that it starts with a smaller setting and having facilities like ours.
Okay, excellent. I love it. All right, until next week, wish you guys the best.
Appreciate it. Thank you.